Hey folks, welcome to DocTalk. I'm Dr. Dan Thompson. Today we're going to have a show on calf diphtheria. Not little baby calf diphtheria, but we're going to talk about big calf diphtheria that we see in the feedlot in some of our Midwest feed yards, cattle from 21 to 40 days on feed. Should be an interesting show full of great information.
Closed captioning brought to you by Ag Promo Source. Together we grow. Learn more at agpromosource.com. This segment brought to you by Kansas Regenerative Medicine. Your stem cells, your health, your life.
Welcome to DocTalk. I'm Dr. Dan Thompson here at Kansas State University's College of Veterinary Medicine, where I serve as the Jones Professor of Production Medicine and Epidemiology. And today I want to talk a little bit about calf diphtheria. And when we talk about diphtheria, generally speaking, it has always been when we talk about baby calves that are on bottles or bucket calves, the things that will get a calf diphtheria. And what I want to talk about is more of a diphtheria that we're seeing in adult cattle, whether it's feedlot cattle that we've seen some of these cases, or we've even had a case with it with mama cows being supplemented distiller's grains. What we want to talk first about is let's kind of set up the scenario of the respiratory disease and respiratory tract of the animal. So we start out at the nostrils, and then as you go through the nostrils, you go to the pharynx, which the pharynx is the part of the respiratory tract that is shared both with the digestive system and the respiratory tract. So it's where we swallow and breathe. Then you go to the larynx, and the larynx is the voice box, or it is the moo or the squeal or the scream or whatever. We then go to the trachea, and then once we get past the trachea, from the trachea down, it is considered the lower respiratory tract. So we go to the bronchioles, to the bronchi, to the bronchioles, to the alveoli. Okay, and that's when you get the lungs and things to that nature as we increase this area of the respiratory tract. So the upper respiratory tract is from the trachea to the external or to the nose, and the lower respiratory tract is from the end of the trachea and to the bronchi, to the bronchioles, and the lungs in general. So why is that important? Well, the reason why that's important is because depending on if you have an animal that's having respiratory distress, depending on when you hear the noise, like if I hear an animal grunt during the expiration, if I hear a noise during expiration, I know that the disease is in the lower respiratory tract or in the bronchioles or in the lungs or the alveoli. If I hear a noise such as as an animal's breathing in or during inspiration, I know then that the problem the animal has is in the upper respiratory tract. So if you hear it when they're inspiring or when they're taking a breath in, that means that the disease or the injury or the whatever the obstruction is in the upper respiratory tract. If I hear it on expiration, like an AIP heifer, when they kind of grunt to get that noise to exhale, or they're having trouble with expiration, breathing out, we know that the problem then is in the lower respiratory disease tract. So important for you to know. When we are going to come back, we're going to talk about calf diphtheria. And the one thing I want you to know is calf diphtheria occurs in the larynx. So diphtheria occurs in that opening from the nose to the nasal passages to the larynx. It is the voice box of the cow. And when we have some sort of irritant that allows a bacterial culture to set up, we can wind up with a disease that we call calf diphtheria. Remember to always work with your local veterinarian. We're going to take a break, and when we come back to DocTalk, we're going to get into what causes diphtheria and the clinical signs that are associated with that disease in your cattle.
Ag Promo Source is a unique group of marketing specialists with one mission: help your ag business grow. Each affiliate has their own area of expertise, and they work together to bring you advice, products, and services. To get started, visit agpromosource.com. Ag Promo Source. Together we grow.
Healthy cows start with the new hired hand automatic livestock sprayer. Rancher invented to provide an efficient alternative to pour-on and injectable parasite management systems. The portable design allows cattle to treat themselves head to hoof. Strategic device placement with pass-through activation technology takes the stress out of parasite treatment for cattle and the rancher, leaving more time to tend to other vital tasks on the farm. To learn more, visit cowsprayer.com. The new hired hand makes healthy cows easy.
This segment brought to you by Santa Fe Trail Meats in Overbrook. Visit us online at sftmeats.com.
Folks, welcome back to DocTalk. Dr. Dan Thompson here at the College of Veterinary Medicine at Kansas State University. We're talking about diphtheria in calves or cattle. And diphtheria is, as I mentioned before, is an infection that occurs in the larynx or the voice box of the cow. The bacteria that causes calf diphtheria is called Fusobacterium necrophorum. And if you've heard that before as a rancher or a feedlot owner or a veterinarian, you know that Fusobacterium causes multiple diseases in the bovine. Fusobacterium not only causes diphtheria, but it also is the bacteria that is associated with liver abscesses in cattle, and it is also the #1 pathogen and associated with foot rot. So when we hear Fusobacterium necrophorum, we're thinking foot rot, liver abscess, and calf diphtheria. And generally speaking, diphtheria occurs a lot less often than what we see foot rot and liver abscesses. Fusobacterium is around in the environment, in dirt, in soil types. It's common in feedlot paddocks. It's common in pastures, around ponds, different things to that nature. When we have a problem with Fusobacterium, usually there's some sort of insult of injury to an epithelial tissue, and then we wind up having the subsequent infection with the bacteria setting up. In foot rot in cases, whenever we have muddy conditions and we get soft hooves and we get the soft skin between the toes, and then the cattle that dries out and the cattle are standing in the mud bogs, and then they walk up to where it's dry and they step on an old cow track, that will cause an irritation between the toes, which opens up that skin to allow Fusobacterium to then colonize or cause a lesion like we see in foot rot. Okay? So when we have calves that are calf diphtheria, we also have some irritants that I think are proposed that we're seeing with the feeding of some of our high moisture corn, silage, and distiller's grains, and we'll talk a little bit more about that. So what does a calf with diphtheria present? A calf that we have seen, calves with diphtheria generally present about 40 to 60 days on feed after weaning, and they will not be losing weight, but we'll start to hear an inspiratory type noise. So we'll start to hear that as they're breathing in, indicating that there is a narrowing of that larynx. For us, laryngitis means we can't talk, okay? I don't know if a cow can't moo, but I know that a cow has difficulty breathing quietly when we have the calf with the laryngitis. So on the larynx, you can see right here's a picture of a normal larynx and one that does not have any type of laryngitis. And then when we do get the Fusobacterium to set up with diphtheria, here's an endoscopy picture of a calf that has laryngitis or has calf diphtheria. You can see the swelling and the folds of the larynx, and you can see where that animal has a decreased amount of opportunity to be able to take a breath in and really function normally. So when we come back, we'll show a little bit more about some of the severity of the signs, and we'll get into some of the things we can do to treat these animals after these messages.
I'm Rexanne Strew, veterinarian in Western Iowa. I have a veterinary clinic and started doing stem cell therapy on dogs in August of 2014. And after the first 2 dogs, after 3 weeks, I saw such dramatic results. I said, hey, I have arthritis. I have joints that really need this help. Where can I go to get this done? I had stem cell therapy done in November of 2014 on my finger joints, my hip, and the ball of my left foot, all of which I'd had real severe problems with. Saw a pretty dramatic improvement in a short amount of time. I would certainly recommend that somebody don't wait until I'm in the position that I was in with the damage already done to my joints. I encourage veterinarians to use it for their animals, and I encourage anybody who sees this video, if you have need, get in contact with these people, because this is a phenomenal place to have this done.
Your investment in the Beef Checkoff is opening new doors for beef. Today and tomorrow, our commitment to long-term planning helps ensure your profitability from one generation to the next.
Hello, this is Caleb Plyler and Son Charolais. This is my son Huck and my wife Brianna. And we operate a purebred Charolais operation in Hope, Arkansas. You know, in the business that we're in, the beef checkoff dollars are very important to us. A lot of that money is to educate people, just like kids that's in Huck's class, the importance of eating beef. You know, it's a high protein product that it's a very important part of our diet. Sometimes we get this bad rap as beef is not, you know, what we really need to be doing from a dietary standpoint. But, you know, being able to get to the kids and let them know that, you know, beef, it is what needs to be for dinner. You know, one of the bigger things with our family is getting to go out and show off some of our cattle. Huck, he gets to show a lot of heifers.
A lot of what we do trying to get him into showing is the fact that it's teaching him discipline, respect for the animals, and it's going to continue to give him lifelong skills throughout his life.
But I think it's very important that, you know, the next generation understands how important the beef industry is. Just like Huck here, we plan on him one day operating this farm. And, you know, if we can do that, we're doing what we need to. Because, you know, this country is founded upon people that, you know, have family traditions and do a really good job of keeping those traditions going. Huck, one day, what kind of cows do you want to grow up to have, you think?
Charolais.
Charolais, all right. You know, if the beef checkoff dollars are going to really good causes and really promoting beef, then the consumers are going to want to buy more beef, and that leads for us making more money in the end, and it really helps the quality of people's cow herds because we're able to enhance our genetics even more.
Hi, I'm Kim Mandarin with Hardy Insurance. I'm here to help you with all of your farm and ranch needs. When it comes to protecting your operation and your family, you need a name you can trust at a price you can afford. Call me today or visit hardyaviationins.com.
Sure Crop Fertilizers was started by my father, Don Sherman, and my mother, Shirley Sherman. Family business that started in the 80s. We predominantly focus on plant nutrients and what we can do to give growers better responses with the fertilizer dollars that they do, and what we can do to make those things work better for the grower. We're based out of Seneca, Kansas. We work with growers in their soil analysis to figure out what they need, and then we can put those in a blend that gives them the best results, and so that we can deliver that direct to their farm so that they have those nutrients where they need them, when they need them, and so that they can apply them in a manner that's very efficient to them and works well in their planting systems and what they're doing. Sure Crop Fertilizers has been around for a long time. We always say we're big enough to take care of everything you need, but we're small enough to do it quickly. You can get a hold of us at 1-800-635-4743. Our website is surecropfertilizers.com, and you can always email me at Corey@surecropfertilizers.com, and with any questions you have, we're glad to answer it and work with you.
This segment brought to you by Kansas Soybean Commission. Progress powered by Kansas farmers.
Hey folks, welcome back to DocTalk. I'm Dr. Dan Thompson here at Kansas State University, where I serve as the Jones Professor of Production Medicine and Epidemiology. And I just want to say thank you for watching DocTalk. Thank you We've been down at Arkansas Cattlemen's, Montana veterinary meetings, different places, different venues, and it's so humbling when someone comes up and say, hey, I watch DocTalk, so please come up and say hi, introduce yourself. I like to understand about your operation and things that you're going through. And if you want to check us out on Facebook, you can find out where we'll be within the United States or maybe even beyond. But anyway, with calf diphtheria, cat diphtheria would have to be somebody else's topic. But with calf diphtheria, what we'll see are these 9-week calves, 40 to 60 days on feed. And again, here's a normal larynx. You can see the nice opening where air would flow back and forth. There on the bottom is the epiglottis, okay? And that is what shuts when you swallow, covers your trachea so that the food goes up over the trachea and goes down the esophagus. Now here as we had some calves that presented with Fusobacterium diphtheria, and here's what their endoscope looked like. You can see this big fold of the larynx folded in. You can see the culture of the Fusobacteria here in the middle of this lesion, and you can see where there's not a very big window where those calves can take in air. One thing I have learned, and here's some video, these calves look normal. The calves and if we treat them early enough, they do respond. But one thing I have observed is that wild cattle with diphtheria don't get along very well because of their excitability, because of their ability to increase the amount of ventilation needed because they're expending energy, that these cattle can succumb to diphtheria a little bit quicker. Your docile cattle have a little bit better time with it. Okay, so to get a proper diagnosis, you're going to find them, you're going to see that they're breathing, they're making noise on inspiration. We're going to take those calves to the chute. The thing that is important about whether it's a hard breather or a calf with tracheal edema or a calf that's with diphtheria is that we don't catch their head in the chute before we give them their treatments. If we think about it, when we take a look at a normal trachea that's here on the left, you can see the amount of space that there is for airflow. If you look at one here that's a hard breather in the middle, or one that would have calf diphtheria that has a narrowed or lessened air intake potential, you will see that this is an animal that is having difficulty moving air in and out. Now, use a scissor catch front head gate on a chute and catch this animal. We will actually see cattle suffocate very quickly because they already have impeded airflow in their trachea. We put just a little bit of pressure on that trachea with the bottom of that head gate, and we can occlude their breath immediately. So when those calves are coming into the chute, we want you to work with your local veterinarian on a therapy. Usually most of the things that are good against bovine respiratory disease are good against calf diphtheria. We want to make sure that you draw that up prior to the calf coming into the chute. The calf comes into the chute, we catch it with the sides, and we're going to administer the antibiotic. A lot of times, we feed Tylenol for liver abscesses, so antibiotics like Zuprevo, Zactran, Draxin, Micatil are all macrolides that can treat animals very effectively for calf diphtheria or for respiratory disease. You need to make sure you work with your veterinarian and make sure that it's either labeled for respiratory disease or make sure that the veterinarian can write you an extra label use of an antibiotic. We're going to take a break. When we come back, we'll talk about what causes these and how we might be able to prevent diphtheria in the future.
No matter where, no matter why, the Veterinary Health Center at Kansas State University is committed to providing quality patient care to animals and exceptional customer service to their owners. From routine checkups to emergency and specialty care, our world-renowned specialists and experienced professionals are here to discover, to teach, and to heal.
Let us know.
How can I help?
How can we help?
Hey folks, Dr. Dan here. Welcome to our Cattle First Tip, as sponsored by Boehringer Ingelheim Vetmedica. And today we're going to talk about pen floor conditions. Now, when I think about pen floor conditions in confinement, I'm thinking about one of two things. I'm thinking about too muddy or too hot. And specifically, when we talk about mud, We want to be able to control mud. We want to give cattle, we may not be able to control rain and control all the mud, but through building mounds and through making proper ways for water to escape the pens, we can make sure that these pens drain well, and we can make sure that cattle have a dry place to lay down and that they don't have to wade through mud to get to the feed bunk or the water tank or the place that they're going to bed. When it's 97 degrees outside, the pen floor is 137 degrees. So providing some sort of bedding, which is straw, even when pen floors are too hot, can provide comfort for calves to lay down and give them a cooler spot. We don't want pens too muddy. We don't want the pen floors too hot. This is your cattle first tip.
Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment brought to you by Kansas Farm Bureau, the voice of agriculture. To join today or more information, go to kfb.org or find us on Facebook or Twitter.
Hey folks, Dr. Dan from DocTalk. Thanks for joining us today to talk about diphtheria. Now, I talked a little bit about what I thought was causing diphtheria, and I don't know for sure, but in the work that we've done at PAC and with different feedlots around the United States, we tend to see an increase in calf diphtheria in feed yards that are feeding lots of high moisture diet ingredients. And that would be yards that are feeding silage, high moisture corn, and distillers grains that are all wet feeds, which around the Midwest where there are ethanol plants, there's plenty of it. And so what got us thinking about this is because we don't see calf diphtheria in our steam flake grain hay roughage diet type cattle and or ground corn feed yards. So when we're seeing these high moisture feeds come in, and what we started doing was taking a look at the pH of these feeds. And when you start looking at the pH of high moisture corn coming out of the pit, silage coming out of the pit, and distillers after it's gone through fermentation at the ethanol plant, these will have a pH that run anywhere from 3.5 to 4.0. Very, very acidic. And not that I would know, but I just Googled something that would have a pH of 3.7, and wild turkey happens to have a pH of 3.7. So when we look at how much calves eat, about 20 pounds of dry matter, and the moisture content of some of these diets, these cattle can consume 2.5 to 3 gallons of this liquid fraction while eating their normal diet of a pH of 3.5 to 4.0, which can cause the irritation on the back of the throat. I actually had a producer come up to me and said he was having diphtheria in his cow herd. And I asked him, I said, well, do you live close to an ethanol plant? And he said, well, yeah, by gosh, I do. Well, we go to find out he was supplementing these cows a lot of distillers grains, and you get some of those boss cows consuming more than the others, and it can lead to some issues, get that irritation in the pharynx and the larynx, allow that fusobacterium to set up, and then we see the diphtherias, okay? So just a word to the wise, if you're feeding these high moisture feeds, watch out for diphtheria cases and be prepared to treat them. Now, how do they resolve? If we catch a calf early in the disease process, so if you hear a calf that's starting to wheeze, bring them in and treat them per your veterinarian's directions. Because what we have seen is that if we wait too long to where we have a change in the anatomy because of the swelling, you saw how if you look at this larynx, you can see how this folds in. Once we get the scar tissue build up, it takes a long time for that to dissolve, to resolve and go away, if it does at all. So the key to treating is to make sure that we give these calves treatment, get them in right away, treat them with a macrolide or with a respiratory disease drug, and we should have great success. Wrap up, diphtheria is seen in yards that are feeding high moisture grain with distillers and silage. We see it about 21 to 40 days on feed. It's very responsive if treated early. Don't catch their head because they can suffocate. Thanks for watching DocTalk. I'm Dr. Dan Thompson. Always work with your local veterinarian, and if you want to know what we do at DocTalk, you can find us on the web at www.doctalktv.com. I appreciate you watching today. I'm Dr. Dan, and I'll see you down the road.
Closed captioning brought to you by Ag Promo Source. Together we grow. Learn more at agpromosource.com.